11 cases of polio have been detected in children in the Indonesian province of East Java. 9 of the children are believed to be asymptomatic, while 2 are being treated in intensive care. Health authorities are launching a mass immunisation drive. Indonesia was declared free from polio a decade ago by the World Health Organisation. And joining me live now is infectious diseases specialist Robert Booy. Robert, welcome. Why has there been an increase in cases again after all this time?
Well, polio is highly infectious and it needs the population to be highly vaccinated. Now, Indonesia's pretty good. It's had 80 to 90% polio vaccine uptake in children across most of the islands. But there's been a recent, very small outbreak. For every case in hospital in intensive care, there's probably 100 others that are asymptomatic. So when you said 7 asymptomatic, there's probably 200. So it's spreading in the community for an unusual reason. The actual vaccine that they've used has mutated and it's gone into a circulating form that's more dangerous to humans. So it's an unfortunate aspect that polio can sometimes revert to neurovirulence. It could become nasty again, even as the vaccine. And the reason that occurs is that vaccine uptake is not enough. So people get infected and then they pass it along the line of other children who aren't vaccinated. And in unvaccinated children, the polio variant mutates and goes back to a nasty form. So it's unfortunate. It should be rectified with higher vaccine uptake.
So this is a very unusual thing. Does this happen often where a vaccine mutates, and is it quite dangerous?
It happens occasionally. At this point in time, there's very few polio cases around the world. Some of them on the border with Pakistan and Afghanistan are wild polio, but there are some in other parts of Africa and Asia that are due to this circulating form. The numbers are not high. We're generally winning the fight, but polio, we've got just that last few cases in a few countries to get on top of. And whenever there's war and strife, we have lower vaccine uptake and people then start spreading it because they're not vaccinated.
Now, Professor, thousands of Australians and their children travel to Indonesia every month. Does this outbreak pose a threat to Australian citizens?
The simple answer is that as long as your vaccines are up to date and children get 3 doses in the first 6 months of life, then a booster in the second year, as long as they're up to date, you'll be fine. And Australian polio vaccine uptake in children is 95%. It's a little bit lower in adults. So if you're travelling, especially if you're going to the countryside and especially if you're staying for at least several weeks, check with your travel doctor, check with your GP to make sure your vaccines are up to date.
So let's talk about the symptoms. Most of these children that are infected, they're believed to be asymptomatic, while a few others are actually in intensive care. Are some children more prone to developing severe symptoms over others?
Yes, we don't know why, but for every one severe case that ends up in hospital with paralysis, there's at least 100 others who have at most a minor infection with some nausea or some diarrhea or a cough and a cold. So in the great majority of people, the polio virus is fought off naturally and even better if you're vaccinated. But for some reason, probably a genetic reason, 1 in 100 or so can get it much more severely and the virus can lead to paralysis.
Now, health authorities there are launching a mass immunisation drive. Should we do the same thing here if we are planning to travel overseas?
No, we don't need a mass immunisation drive. We've got very good rates of immunisation in Australia. We barely ever see polio in Australia. Only when it's imported, comes on a plane in a child who's got infected in Asia or Africa. No, we're fine. We're very well protected here in Australia. And if you're travelling, they're the times to check. The other place you can check is the Australian Immunisation Register, which you can do yourself online.
Professor Booy, thank you so much for your time this morning.
Pleasure. Thanks for having me.